Hello?
Oops. Yes, can you hear me?
Yeah, I can hear you.
Okay. So as far as being in the southern part of the county, unlike more of the downtown and central parts of the county where we can see the homelessness, a lot of our population is the hidden homeless. So those that are essentially couch surfing or living in their vehicles, that type of thing. So that's one. Another, food security, absolutely. Adverse childhood events is another major concern. Our communities. So do we have the social supports and the mechanisms within the communities to drive healthy behavior change? So where somebody may want to, exercise more, is their community actually friendly enough to allow them to do so? Do they have sidewalks? Do they have maybe a park, green spaces, that type of thing? Colorectal cancer is another concern. So in that sense of engaging patients in early screening for us, we're having issues with identifying effective ways of getting folks into care. Just for the screening. And I think because it's a process with that. It's not just kind of a one step when you come in for a mammogram or cervical cancer screening. That's another concern. And then I think of the tops right now, that's primarily it. And for us also is engaging our pediatric population early. In education. So beyond just the well child visits and things like that, but what type of structures can we put into place as far as group visits for a holistic, whole person type of program where our children go from pre-adolescence into adolescence and certainly into early adulthood with embedded understanding of their bodies and, psychosocial supports and building resiliency and that type of thing. So really our peds population, colorectal cancer screening, housing situations are major things that we're working with.
Okay. Okay. This is really good. Thank you so much for this feedback. And now that you mentioned the colorectal cancer, uh, we've been in contact and we've been having some conversations with American Cancer Society. And this is a question that I have because I'm not sure. This is the first time that I'm going to ask this question to a health center. How is prostate cancer screening an issue in your male population? I mean, specifically because, there is the stigma, there is the issue that sometimes the primary care physician doesn't provide the service. You have to have contact with either a urologist or a specialist. So is that a concern?
I haven't heard of that being a concern. I know that they will do it. Our providers will do it. The only issue is the reason why I'm unsure of that, and I'm going to have to ask for some anecdotal um, information about that because we don't measure it. That's not something that we measure
Yes, that's right.
in-house. So, right, yeah. But I can get you just some initial kind of anecdotal data about that and take a look at our screening. Well, we actually could capture the screening tests that are done, like the PSA, but then the actual prostate exam, I can ask our providers and kind of get an impression of where they see men engaging in that screening. If we do it often, or do we find refusals or that type of thing. But I know that we do them in-house. The majority of our PCPs will do them here.
Okay, okay. That's really good. And the last question before I ask you a couple of questions about cervical cancer is regarding the climate. You are very close to the U.S.-Mexico border, and uh,
Uh-huh.
and I am quite sure that you may have contact with migrant populations and agricultural workers. Do you believe that that is a problem? The climate change and how the climate is affecting the health of these populations that you serve.
Mm, that's a really interesting question. And you know what's interesting about that? Even though we're close to the border,
Mm-hmm.
we don't have a large migrant population.
Mm.
So that is the question that we ask, incoming patients is, are you a veteran migrant worker, whatever have you. We don't have a large population of migrant workers because I think they bypass South County. There's
Yes.
not a lot of agricultural area around here. That's more North County. So you'll find most of the migrant workers will work in North County, and there's a health center system there as well that they get the majority of their care from. But we don't have a whole lot, surprisingly enough, even though we're right on the border, the majority of those workers head further north.
Mm. So basically, they just be there for a couple of days or few hours and they move on.
Exactly.
Okay.
Hmm.
Okay. But in general, you don't see more cases of urinary tract infections, for instance, or anything like that that are related to water loss or the effect of being under the sun for many hours.
We haven't seen, no, I haven't seen that. And that's something that we can, and also, again, that's something that we can be more privy to now that you bring it up. Are we having more cases or more reports of that just in general? Because even, the migrant workers, but there are others that, of course, will be susceptible that are out in the environment working. But no, I have not heard of that. But we also haven't been looking for it either. So that would be a good thing for us to take away and start looking at any trends in.
Okay. 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 This is really good. Thank you so much for the feedback, April. And now I know that you're driving, so I would like to ask you just a couple of questions on cervical cancer. And we are very interested in learning from you if San Isidro has any strategies to either reduce the risk of HPV infection or any STD. For instance, any prevention strategy like sexual education, for boys and girls, or the use of or condom promotion, and then sexual education and vaccination. Is there any activity in particular that you are doing at San Isidro?
Yes, so we actually have within our sites, we have pediatricians, and where we're able to kind of in the visit, we will offer to boys and girls, and especially ever since that HEDIS measure changed to include all boys in HPV vaccination, that education to them. But we have a teen clinic specifically, and also we're based in 2 local high schools. So we use those as the teen clinic is specifically designed for that space for teens to come and get that type of education. They can come in and get, birth control, have those questions answered. They can even get their regular medical visits, but mostly it's all about sexual health in that clinic. So they get their vaccinations, they get that education and prevention and things like that there. So it's kind of a tandem approach where we've created space specifically for teens and their sexual health needs, in addition to in their regular medical visits. And then also being based in the high school is another opportunity to specifically capture that teenage population early on to get them that prevention information.
Okay. Okay, this is really good. Now, the clinical side that you're talking about is how far away from the school is? Do you have some kind of idea?
It's really centrally in South County because we're spread across probably a 20-mile radius. So the
Okay.
teen clinic is in South County, and it's located within walking distance of 3 high schools.
Okay. Okay. That's really good. So you are able to cover most of the teenagers in that area, at least
Right,
those attending the high school and the schools. Okay.
those high schools.
Now, thank you so much for that. The other question that I like to ask you is regarding secondary prevention. And I understand that you have a unit mobile. I've been talking to Maria, and you do a lot of breast cancer screening. is there any activity that you do regarding cervical cancer screening?
Yes. So for cervical cancer screening on the mobile clinic, we've been trying. We have not done it yet, but our plan is to develop women's health days on the mobile unit. Right now, what we've been doing, just because it's a tight space logistically, how the visit would occur is kind of what we're working out, the workflow of that. But what we're doing now is, in conjunction with the mobile unit and a clinic, we'll base the mobile unit at a clinic. And so we design our women's health days around, you can come in to see your provider, you can get your cervical cancer screening, transition out to the mobile units and get your mammogram at the same time, so that we're meeting both those wickets for those women that are eligible, and also we're able to get those that are not yet eligible for their mammograms and for care. So that's kind of how we're using the mobile unit and planning to expand the use of the mobile unit so that we don't have to be based at a clinic to do it. The convenience now is that you can get both of those services at the same time, as opposed to us having to refer out for the mammogram and hoping that they get it done and that we get the results back and that type of thing. So it's all the same day now, but we'd like to be able to do everything on the unit at one time, not having to be at the clinic site. What we've done in the clinics, what we found is that we had so many missed opportunities, and that was an opportunity to educate our providers and care teams on the some of the you know, the embedded nature of our population. They're transient and things like that, so they come in once a year, and that's probably the only time we're going to see them that year. So even though they're here for a specific reason that might not be for cervical cancer screening, we can certainly identify that they're in need of one, and we should, while we have them, do as much as we can. So what we've done, and so we've implemented that. However, when we catch a woman and we say, we see that you're due for cervical cancer screening today, although you're here for something else, can we go ahead and do this? They weren't too willing. So our a team got together and, you know, looked at some best practices, and they put together this hygiene kit for women, so that when we do have them come in, and they didn't come in specifically for cervical cancer screening, they were more comfortable with going ahead because they had this kit in it with wipes and deodorant and things to freshen up with, and they felt more comfortable becoming vulnerable if they were able to have that little bit of something to clean up with, and then we could go ahead and do it. And we've seen an improvement in our cervical cancer screening rates from those two things by really focusing on the people here. Let's do what, you know, we can do during this time that we have them, and then two, let's make it a more comfortable experience for them to be more willing to get it done when they weren't expecting it.
Great. Wow, that's fantastic. That's really good information. Now, and what is the strategy when you have a patient that the pap smear comes back positive, or if the patient has the HPV screening and there is a cancerous lesion? Do you offer any kind of procedure like a colposcopy or anything like that?
We do. So we have OB/GYN providers in-house, and so what's within their scope they manage. Otherwise, we would refer out. When we find a woman that has an abnormal pap, we automatically put them in the state of California, and it may also be in your state as well. But the state of California funds the Every Woman Counts program, and so we're a provider of that program. And what we provide is the case management and coordination for those women that have been identified with cancer such as breast or cervical. And so what we have done is included, of course, in that women who've been identified with abnormal cells from a pap smear, we include them in that case management. So once that's identified, they automatically go into case management, whether they stay in-house and we can manage whatever is occurring right now, if it is that we're doing biopsies and things like that, or if we refer them out, they still remain in our case management through the course of identifying those abnormal cells, confirming or you know, not a diagnosis, and then if they are diagnosed, throughout their course of care in that program. So that's kind of how we manage those folks.
Okay. Now, following up question. I'm sorry. If you referred a patient and probably you believe the patient needs more or additional care, what is the mechanism to communicate with either the hospital or the other clinic? Do you do this through the electronic health records, or how do you communicate?
Yes, so we do it through electronic health records.
Okay.
The hospitals that we work with specifically for that now, yeah, we are able to share records with via the EHR.
Okay. And what about the use of patient's portal? If a patient needs, for instance, any service, in this case, cervical cancer screening or a pap smear, do you send reminders electronically, or how does the patient get any kind of a reminder?
So currently we do telephonic outreach. Additionally, we have a patient portal. Its functionality right now doesn't include the ability, we can send messages. We're working on expanding the use of our patient portal so that we can send those regular update population health type notifications, just like you're mentioning. But we can't do it yet, but it's on our slate actually for this year to expand. We've also included population health messaging in a text message initiative as well. So along with appointment reminder calls that would go out via text message, we're going to include population health reminders as well as a part of the text messaging campaign outreach.
Great, great. Thank you so much. Now, um, this is a question that is based on what you said. Um, do you have any kind of contact with your patients either by email or any other electronic uh, tool that is not the portal? For instance, there are some clinics that they have tied the patient's email addresses to the portal. So even if the patient do not go to, even if the patient doesn't go to the portal, they also get the email. Is that something that is functional right now, or not?
Yes, yes. So all of the portal messages, they wouldn't get, so if we send an email to the patient through the portal, they would get notification via email that they have a message waiting for them in the portal. But we don't use their personal email and send PHI to it. So they would get an email saying, please check your portal mailbox. You've got a message there from your provider. So in that way, it's connected, but we don't use their emails specifically sending that direct information
Great.
back and forth.
Yeah, that due to privacy, right, and HIPAA things. That's really good. Well, thank you so much for this information. I really appreciate it, April. I know that you're about to get to San Isidro Health Center, and unless any of my colleagues here has any additional question, specifically because they are taking notes, nothing. Okay, so we're good. April, once again, thank you so much for this information. We really appreciate it.
Oh, absolutely, of course, anytime. Thank you.
Thank you and have a great day.
Okay, you too. Bye-bye.
Take care.